The next view that we are going to look at is the subcostal four-chamber view. For this, we want the patient to be in supine position with knees bent would be ideal to reduce the tone of the abdominal muscles to bring the image in good view. The probe position is going to be literally almost flat on the abdomen, just below the xiphoid, 1 to 2 centimeters below the xiphoid, and with the indicator pointing towards the patient's left. So we're going to start scanning right there. We're going to use the liver here right below the probe as a window to look into the heart. It's a four-chamber view, but sometimes the aortic valve comes into the view and we don't get a good image that well from the subcostal. But this is a good view for mainly evaluating for pericardial effusion and the right ventricular function. Asking the patient to take a deep breath in and hold is going to improve your view as it pushes the heart down towards your probe. Here you can see the left ventricle, the right ventricle, the left atrium, and the right atrium. The right atrium and the left atrium. You can exhale and then we'll get our model to do that again. As you can see, holding in inspiration is improving the image. There is no fluid collection between the liver and the right ventricular free wall, and that means there is no pericardial effusion. And as you can see, the tricuspid annulus is moving well towards the apex of the right ventricle. That means the right ventricular function is good. This is not a good view to, I'm going to freeze it. So this is not a good view to evaluate for right ventricular size or the valve function, but this might be a very good view in patients who have COPD where other views are not possible to get a quick view of the global function of the heart and to rule out pericardial effusion. As you can see, as I move through this is the right atrium, the right ventricle, the left atrium, and the left ventricle. As the patient takes a deep breath, we got a better view because the heart was pushed down with the diaphragm going down during inspiration. We have the subcostal view again, and we are using color Doppler to check for the tricuspid, across the tricuspid valve right now and across the mitral valve. This is not a good view to evaluate for the valvular function. So you can see here, if we rotate or angle the probe differently, it's going to change the image to bring more of the right ventricle open up. Or as I tilt the probe more towards the abdomen like this, it's going to bring the left ventricle, and then you're going to lose it as we are pointing directly downwards. Again, when I have it flat, you have a good subcostal four-chamber view, and as you tilt the probe the tail up, you are losing the right ventricle and focusing on the left ventricle, and then it disappears. When I tilt it more flat towards the ground, I see more of the right ventricle. A good four-chamber would be somewhere in the middle. All right.